Given that anxiety disorders, including panic disorder, are the most common mental health issue in America, you've got to know that there's going to be a lot of pharmaceutical companies trying to come up with a profitable and quick fix. And there are. I'm not even going to try to name them all. Now, prescription medication can be a good option for some people experiencing anxiety, and that decision is one that should only be discussed with your doctor. I'm not a doctor. I'm not qualified to give that kind of advice, and nothing I say here is intended as medical advice. However, as a former and recovered panic disorder sufferer myself, I do have some personal insight and opinions on the matter, and hopefully your doctor will make you aware of these considerations as well. But I'm going to mention them here just so you can raise the topics with your doctor, just in case he or she doesn't. So the first issue is that medication can cover up anxiety by numbing the sensations. But unless you're taking steps to resolve the real cause of your anxiety or panic disorder while you're medicated, there's a very good chance that the problem will surface again. And the problem is that medication can often dull the desire to take that kind of action. So that's something to keep in mind. The second thing you might question is whether the emotions that you're feeling are normal for the situation, or if they're normal human emotions. Is something about your life not right at the moment, and is your body trying to tell you something? Or is this something you should be trying to suppress? In most cases, anxiety and panic disorder are not due to a chemical imbalance. I'm reminded of when my own father was diagnosed with a terminal illness, and my mother was naturally extremely distraught. Her doctor prescribed her a popular anti-anxiety and anti-depression drug. Anyway, I didn't know about this, but months later, she told me that when she started using that drug, she was sitting alone in her room one night, thinking about how she was losing my father, her companion of 30 years, and she could not cry a single tear. She knew she should, and she wanted to, but she couldn't. I mean, really, do you want to numb yourself to the feelings of life? So question whether what you're feeling is normal for this situation, and whether there might be a better way of learning how to manage this emotional overwhelm. It's hard, and I'm not going to pretend that I know the severity of what you're going through, and I can understand that a quick fix looks appealing. But for your own long-term well-being, think about it a little. Now, a third issue to keep in mind is that the human brain can build up tolerance to prescription drugs in some cases. And this probably depends on what you're taking, but there's a chance that eventually you may need to increase your medication to higher dosages in order to maintain the same effect. More problematic is the fact that if you should choose to discontinue your medication at some point, you may find yourself experiencing the same amount of anxiety or even more than you were before. And I believe most anxiety medications are supposedly non-addictive. But this could conceptually make it difficult to discontinue use. Now, the next thing I want to mention is to not ignore the side effects of the medication you're considering. And you can usually get a good overview of these issues by reading the literature that's provided with the medication that you're taking, usually in small print. But some of the side effects can be significant, including sleep disorder, sexual dysfunction. As a side note, and I don't know if this directly applies, but I recently attended a memorial service for a childhood friend of mine, a family friend who committed suicide. She had been on medication for years, and actually she probably needed to be. We're not talking about simple anxiety or panic disorder here, but a much more serious mental health issue. Anyway, shortly before her death, she had been given some extremely bad news from her doctor related to some health consequences actually known side effects of the medication she had been taking. So it may be pure speculation, but there's a good chance, at least in my mind, that those drugs that may have temporarily made her life easier may have also contributed to what happened. Again, her situation was not as simple as anxiety disorder, but my point here is that some side effects are really serious. So ask your doctor, is medication really necessary for your condition? And get a second opinion if necessary, or even a third, because some doctors are simply not as familiar with psychological issues as you might hope. They're busy people, and writing a prescription is easy. So sometimes you just have to take it upon yourself to educate yourself, talk to multiple people, read the warnings, weigh the options, and then you can make a truly informed decision. And also, once again, I'm not a doctor, so please don't let my opinions here do anything more than raise your awareness of some issues to discuss with a true medical professional. But if there is one bit of advice that I do think I'm qualified to say, it would be that if you decide that medication is appropriate for your situation with anxiety or panic disorder, I strongly suggest that even if you lose the strong motivation, do what you can to try to make a conscious effort to pursue more permanent cognitive or behavioral solutions while you're medicated. But once again, this is just the opinion of a non-professional here, but someone who has gone through panic disorder. Okay, if you'd like to check out any of my other panic disorder related videos, you can view them at mc2method.com/panic attacks. Thank you for watching, and good luck to you.